The weirdest plot twist to all of this is insurance companies are accidentally driving patients to cash medicine by making their own product unusable, which is wild. So like every denied claim creates another direct pay convert. So it's almost that the real battle is not cash versus insurance. It's more transparent pricing versus opaque pricing. I think the cash movement is the real power here. Welcome, Content Crib episode 16. How you doing, Eric?
I am fantastic, Chris. How are you?
I'm doing great, doing great. I thought we'd talk about kind of the direction of healthcare. Meanwhile, we're not, experts on the space, but we do spend a lot of time in it and spend a lot of time with people that are experts in the space. I mean, I guess we're kind of experts in our own right, customized medicine and, helping medical professionals with their brand and whatnot. But thought that we'd cover some topics. What do you think about that?
Let's do it. Love it. Because I actually had some interesting conversations this week with some physicians/founders who wondered why they needed to have a personal brand. So this is perfect timing.
Why don't you start off with that if you want to let it rip? Yeah.
So it was an interesting conversation. I had a talk with a physician that I know really, really well, and he was pretty much like, I won't share who it is, but he basically said, hey, I work for a hospital. I work for a large healthcare provider. And, why do I need to go down this road of personal brand? Why do I need to do this? And I said, well, it's because you need to have your patients know you before they meet you. You have to be, top of mind. And he said, well, why do I need to be top of mind? Because the hospital and the clinic they do all that marketing for me. And my reply was, well, if your partners are getting lots of people coming in and asking for them and they're not asking for you, does that make you expendable? And I could see his eyes kind of open a little wide. And he's like, well, I have a contract and I can do it. And I'm like, yeah, you have a contract, but I meet lots and lots and lots of guys and ladies who are at the end of their 3-year contract, and it's time for their group to make a decision, and who they make the decision for. So anyway, it was just an interesting conversation that opened his eyes to why he needed to have a brand, why he needed to be able to market effectively to patients. And he realized real quick, he's like, yeah, I get it. Yeah. And he said, the thought process, I think, with a lot of surgeons or a lot of physicians is, I don't have a lot of competition out there. That's true. You probably don't have a lot of competition in some areas, but there's going to be others who are going to be employing methods to get patients to come in their door. And if you're not doing it, you're eventually going to lose to your competition. It's just inevitable. So I thought it was an interesting conversation.
Yeah, and I'm glad you brought that up because it's along the lines of the topics that I wanted to discuss today. And as we're seeing healthcare in America evolve and PCPs becoming stretched super thin. There's like a PCP shortage right now.
Mm-hmm.
And at the same time, they're becoming almost extinct because people are realizing they can go elsewhere and get better service, better attention, but they're paying out of pocket. But they're realizing they need to optimize their health. So I'm seeing it in my neck of the woods. I'm seeing, in Florida is a huge market. I'm sure you see it on every corner. Concierge medicine, med spas. People are, shelling out a few $1,000s a year.
I do.
My question, I guess, is this the future or just healthcare segregating with better marketing? And I kind of, and I think it's so important to understand where this is going because of the personal brand and building a following and becoming that thought leader.
Yeah, I am. This is my personal opinion. I think, and I'd love to hear what you think. I really believe that we're starting to watch the marketplace take two very separate paths, and almost like in Europe that occurs, and in Canada and other countries. I don't know about you, but healthcare insurance is incredibly expensive, and probably ruffle some feathers when I start saying all this stuff, but it's incredibly expensive, and you got to wait, 3 months to go and see your primary care physician, or I can buy an extremely low cost plan. If that's what I want to do, I can do that because I'm self-employed. And then I have a concierge medicine doc where I can go see at any point in time, and it's about the same cost. What would you do? And that's just me seeing it. And I think that's what we're seeing right now is the marketplace it's changing, and there's because of the shortage of PCPs, that's a big deal. What do you think?
Yeah, I mean, it's almost more expensive to try to use your insurance because time is money, and the time is such a premium right now. You know, everyone is working around the clock these days. We're always connected, and that $40 urgent care visit to get better quicker, whether that's you or your family, or if you need an MRI, you can go down the street and get it for $300 to $400 instead of fighting insurance companies, because the insurance we're paying for now doesn't cover anything. We're paying 15, 25 grand a year, somewhere in between there, for pretty much nothing. And it is an interesting path, as you said, where it's going. And the public interest at the same time is taking note of that, and also really diving into lifespan, health span, optimizing their health to be more productive in society and to feel better. So I think that's a lot of things happening at once, which makes it super interesting. And, medicine is moving faster than ever with AI and different formulations. I mean, we're seeing it right now. We do tons of clinical studies, as well as different formulations. I mean, there's AI applications to try to figure out better formulas for certain medications that are being developed. So I think all to say the public is more educated than ever. I mean, I think I'm not alone saying that I've used, language models like ChatGPT or Claude to type in certain health struggles I might be dealing with before, calling my doctor.
I do it all the time. Yeah. And I really, I
don't recommend that, but
no. We are not in any way, shape, or form giving medical advice here. But at the same time, the cost of insurance and the cost of, having to go to your PCP and then get referrals to go different places, you said it best. I mean, if you can afford to have concierge medicine, or you can have it, that type of your initial point of contact. So the whole reason we're talking about this is, 10 years ago, did you hear any marketing from a concierge medical practice? No. Med spa, no, you didn't hear any of that. And now you hear it, but I think it's going to be a flurry of more activity that occurs as people are trying to attract these patients, because they realize there's such a void in the marketplace for somebody who's very, very catered to the patient. And and I'm not putting down the primary care providers and big practices.
No, it's not their fault. It's a lot of it is just the system. It's a system overload.
100%. And I don't know about your area. I'm sure where you are is just like mine. The PCPs have created these huge practices with, there's 20 of them in there, and, it takes forever. It's just, it's not a great model. And I think, we could probably do 3 podcasts on this, but, over and over and over, you see Amazon trying to get into, the healthcare world, and, Walmart, I think, is doing it, Now, is that the answer? I don't know. But obviously, when you have competitors like that trying to enter into it, it's a lucrative space, and they're trying to get a foothold. They just don't know how to do it.
Yeah. And I think the weirdest plot twist to all of this is insurance companies are accidentally driving patients to cash medicine by making their own product unusable.
Yeah.
Which is wild. So like every denied claim creates another direct pay convert. So it's almost that the real battle is not cash versus insurance. It's more transparent pricing versus opaque pricing. I think the cash movement is the real power here. It's forcing providers and patients to have a choice or make their own choice, what's better for their life, which I think is terrifying the whole system. And it's also that battle between, okay, well, should these providers make a cash, make cash hand over fist for services. Well, let the marketplace determine that, right?
Mm-hmm.
I'm a big proponent of let the physicians get back control and steer the marketplace back towards the patient. Because ultimately, physicians want what's best for the patients, not these C-suite execs that are just squeezing every last dollar to, private equity out of these hospitals and these groups. So I like to see what's happening right now, and I think it's really exposing it. We have good friends and colleagues that are really, ringing the bell on this, like Preston Alexander was on our podcast early on when we launched Content Crib podcast. And I think all of this is to say these are hot button topics that, we hope everyone is interested in hearing about, but really we just want to get to the point where it's more important than ever to now use that voice and use your platform to talk about what you're an expert in, so people will follow you and trust you to ultimately use you for your services.
Well, and here's a little tidbit. If you're listening and you're a physician and you say to yourself, well, how would I ever start in this? I would immediately steal Chris's idea of being the transparent physician and being very transparent about your fees. And that's a refreshing point of view and a refreshing way to look at it, because anybody who's listening to this right now has gotten the bill from the emergency room or has gotten a bill from something. You're like, you charged me this for this. I would have never done this if you told me up front. And obviously that's by design why they don't. But anyway, you should steal Chris's idea of the transparent physician. Anyway, that's my thought on that.
Yeah. I mean, it's, there's bad actors too that are kind of taking advantage of the situation. So, let the marketplace determine where you want to go as well. Check Google reviews, get some recommendations from friends, and follow those providers you want to get your services from if you're a patient. Now, back to if you're a provider, I think that there's a lot of great examples about people doing it the right way. We have several surgeons and doctors in our tribe that are doing it the right way, and ultimately patients are on social media and they're on Google and they're looking for education and they're looking for trusted people. I was just talking to my wife this morning about finding a doctor that we're looking for something, that one of us is dealing with. We don't need to go down that, but and that's the way we're going to do it. Look up Google reviews, try to see other people that have experienced the same way, see if they're sharing any content on their social medias, and then make some phone calls and ask how their funnel works, how the consultations work, and go from there. And, hopefully maybe one of them is sharing a lot of videos on one of their social media pages talking about how it works being a patient at the practice that they own.
Yeah, no, absolutely. And the thing is there is some examples out there of physicians who are doing that, but I think the ones that are diving in and you can see those who are out on social media, the Dr. Molly's, Dr. McClellan's, the Dr. Sigmund's, Dr. Redler's, those guys that are out there that are doing this on a regular basis. Now, people go, oh yeah, I need orthopedic help and I'm in, right outside of Boston. Who's that guy with the wavy white hair that does the cool TikToks? That's how they're going to remember you. So that's Dr. Sigmund, if you guys are all wondering what I'm referring to, but that's where it's all going to. That's where it's going to move towards.
Yeah. And another interesting one is medical tourism. And I think this is so fascinating because more and more Americans are flying out of the country to Turkey for hair transplants or Mexico for dental work. That's a big one, the dental work. Well, just don't get me started on root canals, how terrible those are for you long term.
So Johns Hopkins has a facility in Panama. I mean, there's... Oh,
wow, I didn't know that.
Yeah, they have a facility in Panama, and they're, there's... Watch how that is going to explode. It really is, and it is, because, you can go to a country and get fantastic care for a third of the cost. I do know that there are some out there that even have the cruise ship model, and I don't remember some of the companies that are doing that, but it's go get your total knee done on a boat. I don't know if I'd want to do that or not.
It's like
but
pirate ship surgery.
yeah. If anything goes wrong, they just kind of throw you over the side. Nobody knows. But I'm kidding, of course. Yeah, but it's interesting that's that concierge, and there's so many people who are traveling abroad for stem cell therapy and things of that nature too.
Well, yeah, we had to do a little bite-sized episode this week, and thought this would get the juices flowing with some, those of you that are listening. And I thought this was a fun little mini episode for us today.
Yeah, a little bit of a different way to look at things for marketing. So, and who knows? Maybe we'll record another episode this week and keep them coming like this.
I like that, Eric. All right, take care.
All right, see ya.